Hello everyone, we are starting out our show today talking about Primary Children's and Intermountain Children's Health and how they are expanding behavioral health services. Here with us right now, joining us virtually, is Katy Welkie from Primary Children's Hospital, also president of Intermountain Children's Health, as well as Greg and Julie Cook. They are the ones who generously donated a very large sum of money to help expand behavioral health services to children here locally. Happy that they're all joining us via Zoom. Start out with Katy. Katy, tell me more about this expansion of behavioral health.
Good morning. Thanks for having us. So this is a really exciting part of our overall initiative to really create a model healthcare system for children with the Intermountain West. And behavioral health is such an important part of that. We've seen an increase in emergency room visits for children. We've certainly seen an increase in the suicide rate in our children from the ages of 7 to 17 or 8 to 17. And we really thought we need to do something different. We have to change things. It's such an incredible community. We care so deeply about our children, and we really need to put efforts in place to really change the way we take care of our kids in the mental health area.
Katy, were you noticing at Intermountain and especially at Primary Children's Hospital that kids had more behavioral health needs than in the past?
Oh, absolutely. I think this is happening across the country. And certainly is happening at Primary Children's. Our emergency room visits over the last 8 years have actually increased 300% in the area of behavioral health crisis or behavioral health need. And we know that the emergency room is not the best place to receive care for this type of need. And we really wanted to move upstream. We wanted to avoid the crises, and we wanted to make sure that kids could be getting the right care in the right place at the right time and the right level of care, which is really important.
And what exactly does this expansion entail, Katy? What does it mean that you are able to bring more behavioral health services to children, not at Primary Children's, to include Primary Children's, absolutely, but also to other facilities for Intermountain?
Yes, there's actually a number of things that this is bringing. This gift is just really opening the doors to incredible opportunity. We're creating a assessment, referral, and consultation service that allows us to with one phone call, the family, the patient, the provider can call, but within one phone call, we can do an assessment and then make sure that we're connecting the patient to the right level of care. Perhaps provide some care right there on the phone, but then also get the patient to the right level of care at that moment. It's allowing us to expand options like telehealth. Particularly in our rural areas, it's so nice to be able to stay in your community and be able to do that over the airwaves, just like we're doing Zoom today. And it makes such a difference, and kids like it. Kids are used to using their devices. They're very comfortable using their devices. So we really want to be able to expand our telehealth options. And then finally, very, very exciting, we're going to be able to open behavioral health services in Utah County when we bring the new second Primary Children's location in Lehigh. And this will provide both outpatient services as well as intensive outpatients, and then a really important inpatient unit that's going to be available for that community. So again, care closer to home.
Very important and very exciting to hear that these services will be expanded. There is a need. And Greg and Julie Cook, it's due to their generous gift of $10 million that really is making this possible. We're so thankful that Greg and Julie are joining us now. I'm curious, Julie, what made you decide to make this a priority?
When we first sat down with Katy and others at Primary Children's and learned of their desires to build a new Primary Children's Hospital in our community, and one of the areas that they showed us was behavioral and mental health. And we have had close friends so we've been aware of the need. There's been a big gap between need and between the ability to provide all the services that these children need. And so as we've seen in our own community and with our own friends, that they haven't been able to get to the resources and find the help that they need, we felt like this is where we could make the biggest difference and really move the needle in helping our community and helping friends and family that we love.
And Greg, you're a founding member of doTERRA. You also are part of the governing board at Primary Children's Hospital. There's so many places that you could put your finances, but you decided to invest in this cause. I know that Julie mentioned some reasons why, but how come this is personal to you?
Well, we are engaged in many different things, but it's always important to us to find ways to maximize and sort of leverage to the best of our ability, and to partnership with Intermountain, one of the premier organizations in the whole world, has been extremely important to us. I know one of the first exposures we had to suicide was with just an 11-year-old boy. And I remember thinking, something's different, something's changing. I've never witnessed or heard of this issue being so impactful. And as we learned of the research, that Utah was pretty much dead last in the nation in terms of funding and resources, and the ability to partner with Intermountain at the same time, it really did create an opportunity to make, as my wife said, Julie, the difference in all of this. And as we came to know Katy and Mark Harrison and Intermountain, we really gained a significant amount of confidence and trust that this gift would make the difference that we needed to in our community.
And Julie and Greg, you both have 5 children. So Julie, I'm curious, is it exciting to see your money really going to such a good cause and seeing it in action? As Katy mentioned, these services are being expanded in real time.
Yes, we've had, because of other medical issues with our children, we've had opportunity to interact at Primary Children's, and it's a long drive. And so we've had many appointments as our children have needed surgeries and benefited from the specialized care of Primary Children's. So to be able to have something so much closer to home and be able to have this for all of our community, that we still have access to that specialized care without having that long drive, is a huge benefit, and we are very excited about that. We've got some extended family that their children have had extensive medical care that they've benefited with the excellency of Primary Children's, and it just makes my heart so happy that those services can be so much closer to them and to others, so that we can all just join in with the greatness of Primary Children's that way.
And Katy, how important are gifts like these to make sure that these services are happening, this expansion of behavioral health services?
They are absolutely essential. I mean, we just can't do this work without the generosity of the community. And we hope that gifts like the cooks will inspire others. Much of the work that these dollars go towards are things that we don't get reimbursement for. They're the right thing to do. They help the community. They actually keep patients out of the hospital, which is great for our community. And I did want to say that we're coming to Park City soon. We already have started work up there, and that's one of the very early areas for expansion of the Access Referral and Consultation Service, this call center that will connect people to resources in their area.
And that's such exciting news coming to Park City. All of this is so important. Greg, I'm curious, what made you decide to become a part of the governing board at Primary Children's Hospital?
I believe that never before in our lifetime has health been more important. Not just physical health, but mental health are equally important. And to be able to support Intermountain in their efforts to do that, I think the world needs a little more hope, a little more optimism, a little more belief that the future is bright. And being a part of the board at Intermountain, I've learned a lot from them. In our business at doTERRA with essential oils, we run in and provide lots of different kinds of support as well. But to partnership with sort of the Western side of medicine has been a dream for us. And Katy and Mark have been so open-minded and welcoming of all sources of help, from natural solutions that we provide. But it's been really important to us to bring a lot of hope and optimism through our contribution and our service as trustees to Intermountain.
And Julie, it's heartbreaking, as we mentioned, when children need these services and they can't get them, whether that's financial access or just availability. So really, your huge gift that you gave is such a testament to what you believe in, and really will be an example to others of really where you want to see healthcare go, especially for children and mental health.
Yes, I have unfortunately had the opportunity to be with close friends as their children have needed these services, and whether it's been a couple days after as they've attempted to harm themselves, and seeing the heartbreak of some close friends that have not known even where to turn. And to be able to know that there is just a number that you can call, and as Katy was describing, that you can have the assessment done so that these parents can know the resources that are available to them, because I think sometimes it is financial and other times it is because we just don't know what resources are available to us. And then there's still another layer that when you find those resources, that sometimes there's not room or there's a waiting list, and you can't have access to them. And so to be able to tell somebody that's in this crisis situation that there is hope and that there's help, and give them the access to those resources is such a gift that I think all of us will be able to benefit from. And so we are thrilled that this is being used to maximize people's wellness overall. And so we're really hopeful that it will just be magnified through others' help, and with Katy and Mark just making the most of the money that we are giving.
And Katy, where can we find more information about these services?
primarychildren's.org or intermountainhealthcare.org. Either one of them will get you to the information that you need. And I really want to pick up on what Julie and Greg said. There's hope. And I think that's what the message needs to be to the community. There is care out there. We just need to get people to the right place at the right time and the right level. So it's exciting. It's exciting times.
Well, thank you so much, Katy Welkie, for joining us today, as well as Greg and Julie Cook. This is really big, exciting news here locally and across the entire state, and really across other parts in the West, that these expansions of behavioral health services for children are being expanded. So thanks again to all three of them for joining us today.